and I did a lot of men. So I did really well in school, ended up getting a bachelor's in biochemistry, and then started sort of on a journey. I went back, I'm from St. Louis. I went back to the St. Louis area, and my first job was at Monsanto, which was, I had acquired Searle Pharmaceuticals, if you know them, not that long before. And I started down my biotech journey there. And I think that right away, I was impactful and got involved in a lot of process development and started to learn how to build plants and how to make products. More like a generalist, doing a lot of things across a lot of different areas, but still deep in science in the lab. So I spent the first 8 years in the lab, and then I followed my husband, first time ever, to follow someone without a job to Chicago, and went into quality organization in Searle. So I ended up staying in the same company, which my career from science to quality. Talk about a career changing moment. And that's probably a career defining moment. Not because I didn't want to be in the lab, there just weren't a lot of options for me in Chicago. I actually thought it would be career suicide, to be honest, because everyone around was like getting deeper and more specific into science. And here I was taking a kind of a left turn. I was a new mom. My son was 9 months old. And I was just, finding my way. But I think it turned out to be my personal best move, because it taught me how to use my science degree to really think about things a little differently on the business side, and to learn from business leaders, having really old products that are meaningful. I mean, I'm old enough, I'm in my 50s, my kids are 27, 24. When the first SARS epidemic, when we couldn't make enough Solumedrol, Solucortef out of Searle, I was responsible for those products and releasing them to the market. I was learning a lot about things that were not necessarily scientific and compliance. And then 20 years at being Pfizer, 5 sites I moved to. One of the things at Pfizer is acquisition means ambiguity, site closures, opportunities for me. So we moved many times, moved our family to the UK. Our kids grew up in the UK. And then when we came back with Pfizer in 2011 to New England after they closed the sandwich site, I had taken on a role back in early 2000s, leading device development, which is also another career changing move for me. So I led combination and product device development at Pfizer and Biogen for almost 20 of those 25 years. And that was a move not that I made. Somebody asked me to do it, and I said, I don't know anything about devices. And they said, you clearly are adaptable and capable, so why don't we give this a go? And I did, and then I stayed in that a long time for 2 organizations. That's where those 15 products come from. Came back to the Boston area when they closed the sandwich site, went to Biogen, and then next career move that was huge for me was meeting, I knew Bob Ballinger and Amy Schulman. Amy was the chief counsel of Pfizer and led a business unit I interacted with, and of course Bob Ballinger, and they asked me to come over to Lindra. And I've been working in patient-centric products forever. Thus, I probably would have been a physician, something that's patient-centric, something that helps people. And they said, hey, why don't you come? So I was at 100,000 person Pfizer to 7,000 person Biogen. Why don't you come and be the 11th employee at Lindra? And I said, all right, let's do this. And without those guys, back to probably mentor questions later, I said, I want to do it, but I also don't want to be the technical lead. I want to pivot and do something completely outside of my comfort zone. And that's when I joined, and you heard the story at the beginning. So in 8 years, I went from not sure what the job's going to be, just going to help make it happen, and then to COO president. And I took over as CEO a couple of years ago. And last week I handed off to a new CEO for the next adventure. So I'm on transition and super excited about it.
Thank you, Jessica. So you mentioned 2 important turning points in your career journey. One, of course, there were more than 2, but 2 of them that took my attention was relocating to UK and then joining Lindra. Maybe first talk a little about relocating to the UK. Can you tell us a little about the challenges that you face in your in relocation to the UK, and how these challenges shaped your career moving forward?
Yeah, so I'll weave in a little bit of the women's leadership, if that's okay, because I think it's relevant. And remember, I'm from the Midwest. So I went from St. Louis to Chicago to Kalamazoo to England. And so I was in early 30s. My younger son was 4.5. My older son was 7. My husband worked at Pfizer as well in a completely different space, industrial hygiene, potent compound. We didn't work together. That's a life lesson. You work together, you probably kill each other. So we didn't. We were separated, but we were definitely, visible. And the first one of only 2 couples in Pfizer. A lot of people move from Sandwich to the U.S., but nobody moves from the U.S. to Sandwich. So that was a very different time. We were very excited, and they really wanted to have more people move from the US to the UK and mix and match between the locations. So we did a lot of interactions, a lot of talking about our family life. So we were very visible. One of the most difficult parts is I went there to lead. So when Pfizer closed Kalamazoo, they said, Jess, please, we want you to move your device group to the UK. So I had a group of about 30-ish, and nobody moved but us. It's a hard move to move your family there, but more importantly, like the cost of living changes from Kalamazoo to the UK. Just everything's different. And we didn't go on global employee status. We had no cushion. We went as local employees. I still have a UK pension. We bought houses. We were going to live there. We integrated our kids into village schools. So I loved the experience, would do it at heartbeat. But what was really hard was the job. I took over everything non-inhaled devices, and I'll say a few words and it sounds like I'm being uninclusive, but they're my closest friends and they'll tell you they call themselves this. So I was the manager, probably half the age, or just under half the age. Some of them were in their 60s, some of them were in their 50s, of very many men who grew up in Cambridge and Oxford, and they reported to me. And they also used to call me a magpie. They used to say lots of sort of rude things about and magpie in the UK is not a compliment. That means you can take on a lot of things and remember a lot of things, but like they just didn't understand me. And I was capable of taking on a lot of information and using it, but also I came from what they considered sort of the Pfizer mothership. So it was very hard. And English is not the same in both countries. And Midwest English is way more casual than East Coast English, than British English. And so it's very complicated. We were there for almost just over 6 years, and we had great mentors. I had one mentor, his name is Steve Wicks. And for those that ever worked with him, you'll know this. He pulled me aside one day and said, Jess, assertive is not aggressive. Do what I brought you here. Get in there and lead. Stop being worried that you're a female. Stop being worried that they're gonna, all the things we get coached about, like do your Wonder Woman pose. I've even had people tell me I've got to talk more and sound more like a man. Like I've got to be deep voice, all this stuff, it's like crazy. He said, just go do what I brought you here to do. And again, those guys are some of my closest friends. And when you get down to it and you work as a team and you work hard on products, that's what we remember. We remember fighting hard for getting products approved and all of that stuff, and then a lot of mutual respect. And I brought a lot of those people to Lindra as consultants over the years to help us get Lindra done, and they show up in a heartbeat to help us win, because it's, once I could kind of get out of my own way, they should get out of my way too, but that's all right. I got out of my own way. I had some help. It worked out, but it was hard, super hard.
So since you brought up the mentorship part, I would like to ask a question about the mentorship. You mentioned that you had a mentor in UK who has a crucial role in your career success. What advice do you have for us to find the right mentor and maintain the good relationship with the mentor?
Well, I think you need different mentors for different things in different times in your career. So you can have more than one, and you should. I think you should find senior female mentors for different reasons than you might think. Having people that go through so many things as females, now we're speaking loud about menopause. Guys, being a leader that's in menopause, it is hard. It's as hard as having kids. We should talk louder about it, like your brain goes crazy. But we don't have a lot of that, right? We have to sort of being a breastfeeding mom and standing up and presenting and having, issues with you haven't been able to pump yet. All those things matter. Having allies all around you, just going through female life changes in front of all these people that may or may not understand it. And then you need career mentors. And I think those could be are shaped very differently. And they can be any shapes and sizes. And I think that for me, my first mentor, honestly, was my father-in-law. I have known my husband since I was 17. I come out of the Midwest, as I said. I had no other real mentors. I applied to school, one school, University of Illinois, because that's the school I was in. I was in Illinois area, and I got in and got Pell Grants, and that's how I actually went to college. I applied because all my friends were doing it, not because I knew that's what you should do. But my father-in-law helped me get my first job because he's a chemistry professor, and so without him, I wouldn't have gotten into the networks and having jobs in St. Louis, and then having different kinds of mentors, whether that be scientific ones that could teach me things in the lab, and then get into this leadership stuff as I started to go along the way. And by natural design, most of my bosses, I only had one female boss my entire career, and that's Amy Schulman, the first CEO of Lindra. It's a little different having CEO bosses, I have to tell you. But having CEO mentor or female mentors, I think you need to be brave. You need to say, who do I think? Some of them happen by design because of the role you're in. Some of them happen by you asking, and everybody's always very generous when you ask them to be a mentor, but you need to be thoughtful about what you're asking them to do. If it's a mentor who can pull you through and be an advocate because they're in your organization, that's very different than it's a mentor. I have a peer group of mentors in a CEO forum. They have no accountability in my career. We just talk. They just give us ideas. And we're just, we can share stuff that might not be shareable in my team, in my own working peer groups, or like right now I have a board, I have direct reports, and I can't talk to either one of them about some stuff. So you just need to take stock with what is it you're trying to do? What time are they going to spend with you, and what are you asking of them? And if they're in your line of reporting or in your organization and can influence your direction, you need to be very thoughtful about that differently than people who aren't in your organization and really there just to give you a mirror to kind of talk through some things or practice some things, or honestly just scream or break down and cry or whatever you need to do, because women cry, it's fine. We just get pent up, it just comes out, can't help it. So sometimes you just need a safe place to like get it all out and move on. And I think those are different shape and size mentors. But I'd advise you to get them, because you can't use your partner or your family all the time. They don't understand, or they can't really relate, or they might not be able to give you advice. You need safe zone mentors that have nothing to do with influencing your career. And then you need people that know the organization around you to help you navigate it and give you some safety nets.
So Jessica, during this, you mentioned a lot of challenges that women face. So I would like to ask some questions related to that. You mentioned challenges that you had in the UK, challenges during raising up kids, during menopause. So what do you think training can do to support and advocate for themselves in the workplace, even if they are not in the leadership role, specifically women trainees?
Yeah, I mean, thankfully, I hope it's come a lot longer, a lot further. I'm not going to be naive, and I'm not being political. I don't know what's going to happen right now. Things are going to get harder before they get easier. And finding the organizations you belong in that align with your personal needs and values is going to be really important. And it's not so clear what that might be shaped like or what's going to happen. But like when I started, there weren't rooms for working mothers. We had to use the bathrooms, had to use people's offices if you didn't have an office, which I didn't, because we were an open plan, and we have to use an office and put a sheet up and lock the door. And, so I think you have to know what's important to you, and you have to advocate for yourself. Also, I was in a panel last week, actually connected to Nucleate. I think it's awesome that people love the work-life balance idea. And that's great. I also think depending on the role you're in, you need to recognize there's times you lean into your family and there's times you lean into your career. Because some of the roles, like a CEO role, doesn't have a stop to it. It's a job that's 24 hours a day. I have a life, I have a family, and I'm committed to both, and you have to just juggle through it. If you did need services or you needed some part-time working, having a role, it's really hard for researchers and manufacturing leads to work from home. They really can't. The product they're making is in the manufacturing suite. So being realistic about what those are and where you are and where you're headed, it doesn't mean there's a wrong answer, but it does mean you have to sort of reflect for a minute. Is this the time I lean into my family and just kind of balance it and figure it out? Or do I need to make some personal changes? And then what do I advocate? I think being as clear with your organization as possible, not with either your managers or with the organizations, so you're clear about what they can and can't do. Like, we all run businesses, so we need to think about, the balance. We can't have, 30% of the organization working in manufacturing actually working from home. We would never get anything made. So I think we have to kind of be realistic about authentic conversations, but being an advocate for yourself against whatever your personal, like, everybody has something going on, even caregivers for adult parents, right? Everything's very complex these days. So I think just being brave and being a little bit vulnerable to say what's going on. It's very unlikely your managers, male or women, or men or women, haven't dealt with all of those. Like, everybody has these things. So just talking about what it is to balance it is the best thing you can at least start the conversation. Hopefully you have a manager who does it with you, but if you have to do it alone, you could start that way, and using your mentors in the organization as a way to test that out so it's safe.
I see. And also related to that topic, you have called multiple women network at Biogen and Pfizer. How did this program, I mean, you kind of mentioned that, but can you tell us a little more that how did this program help to your career growth and the workplace?
One more time. Sorry, you cut out there.
So I was just said you related to that part. You mentioned that you call it multiple women network at Biogen and Pfizer. So can you share with us a little about how these programs help to shape the workplace and your career growth?
Yeah, I think that both of them were situational. So the one in Pfizer was both at Sandwich and in the EU. So it gave the Sandwich one was very specific to the Sandwich site, which was the employee resource network for women's leadership within that framework. And then the one that was European was also, but it was cross-country. So that the cross-country one gave a lot of different insights to different cultural considerations. I mean, it was both across in Europe for Pfizer, it would be across both Eastern and Western Europe. And it was very helpful to both lead an organization that had very multicultural, diverse backgrounds of people that came from everywhere. A little less in Sandwich specifically. Sandwich itself was a little more uniform than you might anticipate. There were a lot of French and Kentish people in Sandwich, but still it helped learn tons about things that you might not have seen in St. Louis or Michigan, although going to the University of Illinois and working for Pfizer anyway, it was multicultural. But also from a female perspective, we could meet other women leaders across different ages, all those things we just said, get a natural mentor network about how to navigate such a huge organization. Pfizer being 100,000 people, you're solving at a site level questions than you are at a global level, because it's just more practical about your daily work and where you report to. So having those relationships, there were downsides. People that know me when I do these, there were downsides to being on those, because not everybody thought they were needed, and they'd often call us the jam and tea network. That's what we were doing to meet about whatever women talk about. So that was in, mid 2000s, and that made people uncomfortable. So we had to find ways to make it transparent and authentic and invite allies so that they would dispel the rumors about it. It wasn't a revolution. It was more about finding ways to change it. And as it's, we don't remember this too much in our lives, guys, but it was not that long. It was just over 50 years ago that women started to be able to vote and be in the workplace. It's not very common. Like, our biology is made very different. It's fascinating when you do the science. And so we were starting to swim uphill, a little bit, but it worked. And then when I went to Biogen, we were creating it much smaller company. So it did have a different impact because Biogen as a company was the same size as Sandwich Site. Sandwich Site was 5,000 people, so was Kalamazoo. So when I joined Biogen, it was 7,000. So it felt like we were doing it at a company level as opposed to a site level. And we could start to make some movements and make some transparencies. And actually, Al Sandrock was one of the co-advisors on that and very advocation. He was driving at the executive level. So that had a different kind of impact to organizational policies. And we were working on paternity leave, maternity leave, women's solutions, that kind of stuff. Coming to Lindra, clearly we're 60% women, and the board it was a very different experience because we were already built that way. That was why Amy wanted to start Lindra and asked me to join. We wanted to practice some of those things for the diversity and inclusion. And I brought all of those things with me from all of those experiences. And we have I think at about 2 years ago, we had 40 something people on visas we were managing. So we had men and women and multinational. It was helpful because we had learned a lot.
Thank you for sharing that with us. You've been really creative. I think for us, for new trainee, it will be much easier to make such changes. Since you brought up Lindra, I would like to talk more about that one. We would love to hear more about the time that you joined at Lindra. As you mentioned, it was a pretty small company, just 11 people. And we know, like, in the field of biotech, setting the initial culture is really important for the success of biotech companies. So could you please share with us about the transformative initiatives that you led, which significantly impacted the business outcome, the company's culture, and also your transition from the role of COO to CEO and your journey at Lindra?
Well, Lindra's only 8 years old, so there's not a huge, we went there with a mission driven to be patient-centric, do the first time ever long-acting oral capsule. So nobody's done it before, very patient-centric product. With Bob Langer and Amy Schulman at the helm, it's already very, from a people side, very inclusive, very thoughtful, and we built that. So when we think about the challenges that we had to face there, they were less about human level things and more about the market, the business, and funding the company, and having to do things in a meaningful way that didn't make people, we were in a startup. We have to choose wisely where we spend our money, but also we had to make some significant changes in the last 18 months and how we had to take the company from what we thought we were going to be doing to a more streamlined, focused trajectory, which also included impacting people, closing sites. So we had to lean into empathetic, authentic leadership and transparency to help people go through that and also understand it wasn't personal. And that sounds very cheeky because I've been through 1,000 layoffs over it, and everybody says that. It's horrible when it happens. So we tried to find a way to make it thoughtful and just to recognize it wasn't because the individuals and the science and the people had done anything. It's just literally the market. If you're in biotech right now, you know it. It's hard to fundraise. It's hard to do a lot of things. So we had to reduce our burn rate, extend our runway, think about that, and get the first product approved in a very finite amount of time and not have too many distractions. And so I think that I got the chance to try out some things. I think if those that are around me know, I actually hate being the center of attention. It's never really about me. So I leaned into a different philosophy completely when I took over as CEO, stopped having one-on-ones, and only had team meetings with my CXOs. We share office with each other, so all of us sat in the same room. If I took a phone call with an investor or board member, they heard me take it. I didn't hide from them, vice versa. We talked constantly about everything, so I didn't have to have, people can have a lot of, it was gifted, they're CXOs, they're not entry-level managers. Entry-level managers need a lot of different mentorship as how to be a manager, how to communicate, how to, do workforce planning, how to, be a good person, allow your people to take vacation, but recognize you can't have all 6 people take vacation at the same time or you'll never get any work done. That's, the kind of daily things they're dealing with. Whereas we were like, the CXOs, they're at their level because they've already achieved these things. And so I could practice something completely different. And I think the experiment seemingly worked out. We were doing really well with each other, and it led us to the success where we are. Where now that we've made the changes, the team is there. They're doing awesome. They're going to be awesome. They're doing great. And the new CEO, he's coming in to take it to the next level for commercialization of the products, which I'm super excited about. And without that change, we wouldn't have been able to set this up. But I could practice very different leadership things in the last 2 years and not make it be hierarchical and make it be, it's a team. We use the philosophy, and you might laugh. If you like it, it's good. If you don't, it's quirky. But we use the Ted Lasso, the Believe team. We actually called ourselves the Believe team. And I do believe it was never about me. It's not about Amy, and it wasn't about Trish, who was the middle CEO either. It's about Lindra and the Lindra way and what we're going to do at Lindra. And we just kept leaning into that. So it was less about who was in what bucket and what seat, and more about where we were headed and being mission driven. And really proud. We had a huge amount of change, and people are still there and they're still excited about it. And if you can see what's on my LinkedIn after I announced the changes, people that are across everywhere are still very supportive of where we're headed and excited for Lindra, and feels like a good experiment gone right. So to ask me in a year from now, and when I take on my next one later on this year, and I do feel like these transformations of all these experiences and all this change, to get the gift with Amy and Bob to try it a little different and to see it actually wins, makes me excited about for what we could do if we started that way from the very beginning.
Yeah, Lindra is a young company, but what you and your team have done for it is really admirable. It's a successful company, so I hope they can reach the next step of success. So since you mentioned some of the challenges that you had at Lindra, I would like to ask you about the differences between big pharma and biotech. You work at Biogen, Pfizer. How would you compare working at the big pharma and biotech? And also among our audience, there might be people who are trying to assess their opportunities in big pharma and biotech. What advice do you have for them?
I mean, there's part of this answer probably is not very helpful. If you think about what I said, where I've been in product and device development a long time, I mean, the work I do every day and kind of the transactional work, meaning like who you worry about, what you talk about, what you do, is almost identical every single day. It didn't matter the shape and size of the company. I'd also say people are people. It doesn't matter if you have 100, 10, or 100,000, they all act the same. They all have the same issues at home. They all have the same aspirations. They all measure success on career ladders. That doesn't change. I think what is different is I'm not sure I could do the job at a small company without being at the large company first, because of what I learned and the depth and breadth of the bench around you. Hundreds of people that have been through it that you can learn from. There's just informal mentorship everywhere. I don't think I could be a good general manager. I would not have been able to flip from technical to science if I started in Lindra, because I don't have enough people to learn from. I need to get products through. I need to go and do an FDA meeting, whatever. You need to have the opportunity. And if you're running 50 projects and you've got so many things, and you learn business over here and intellectual property over there, and you know, you're not the expert in any of them, but you're seeing it, you learn by osmosis. You can do that in a big company. When I got to Biogen, I could start to apply it, but there weren't as many, believe it or not, because they hadn't really done device. That's why they brought me there. So I wasn't a device person, I was combo person, but you still needed to have both legs. And without that, I'm not sure I would know if I went the other way around. I know people that are going the other way around and they're really struggling with how to influence really large organizations because it's much narrower and deeper. It's not as broad, and you can't just call the CEO and have a coffee. So I'm fortunate that I think I went the right direction and I happen to be in these bubbles of tech. And I'm very grateful. And I used it as I went, as opposed to trying to figure out what I didn't know. I think if I had started at the small, I wouldn't know what I didn't know. And that's what I see people struggle with when they do start from there. And I see people struggle when they come from large pharma to biotech. Mostly because they're thinking of it culturally. They're thinking like they really, you know, want to have an impact on the people, and they didn't really like where they were, so they're going to come to the smaller one and make a bigger change. That's harder for them because there's not enough people and there's not enough resources, and they find themselves having to wear multiple hats and do lots of stuff in a startup, which they're used to having resources. But I didn't feel that way. I felt very fortunate to have sort of the order I went. And I don't know. I think if you start in a startup, it's good for you to go. I mean, pick on biotech for a minute or pick on pharma. It's the same. If you're in R&D, you should go work in manufacturing for a while. You're never going to make a product that makes it to the market if all you do is do design engineering, because you don't know what happens when it gets out of your hands and people use it. People break everything. So it's the same spirit. You need to sort of see cross-functional. If you're not going to take lateral moves, at least be on. It's not an individual sport, the stuff we do. It's a cross-functional sport. You need to know what regulatory is dealing with clinical is dealing with what manufacturing is dealing with, to even have a fighting chance to getting a product that you're designing in the lab, make it all the way through. And I think I've stayed long enough. I always advise people, you quit chasing the titles, stay in the role long enough to have something you show that you did yourself and you learned something. You got broader, deeper, whatever it is, because in 10 years, somebody that moves a lot for title, we can see it, and we're not hiring you for title. We're hiring you for experience and how you get your job done and how you lead. And if you don't stay in any one job long enough, you can't show it. And I think that's what Pfizer gave me. I was there a long time and I got to see a lot of things, and I moved many sites, and I got to see different cultures and get involved in tons of projects. It helped me be successful at Biogen, and it helped me definitely in these last 8 years.
Thank you. That was actually a very good, straightforward answer and eye-opening. So I see our audience have asked a lot of questions. Maybe I just ask one last question and then we pass it to the audience. Clearly on your career path, you were able to recognize your strength and leverage your strength to move forward. What advice do you have for us? How can we identify the right role for ourselves and perform in a way that the company can't do without us?
I mean, I think actually the opposite. Can I be provocative? The worst thing you can do is have it. If the worst thing you do is try to assume that companies can't do things without us. My job is to put myself out of a job. I'm judged by that in every layer that I'm in, to have people do my job. I just transitioned a CEO job, and it wasn't a difficult transition from a day-to-day because I had already empowered my entire team. You should be doing things that your team can't do. That's what's going to project and make you go faster in your career. Give them stuff that they're hungry to do and let them run with it. They're better at it probably than you are. And if you're going to keep moving, you have to keep taking on new roles that you just don't know enough. So you're indispensable because you are nimble. You take ambiguity. You are someone people can listen to and want to work with. And if the people who act like knowledge is power, we actually move out of organizations because they hoard data, they try to hold in. It's a team sport, so that we need everybody wins when the boats rise. And I think that isn't what your question was, but I think it's important not to hold on to, but if I share that, then I won't be important. I think it's the complete opposite. If you share it, it means you get it. Like, it's not my data, it's the company's data. And I can go do something that no one else has done because they're too scared to try. And I do best when I am scared to death and I don't know what to do. And so I think, if you really are passionate, and there are places for it to be the most senior scientist in an organization, that bodes well to just keep digging deep and publishing and intellectual property and all those things. It's a completely different kind of indispensable. But from a general manager or level of a CEO, it can't be that way. Because your job is to make sure that if you didn't show up the next day, the company would run without you. Right?
Yeah, that's true. So thankfully we had a lot of participants. Now I just passed the conversation to Jingnan to go through the participants' questions.
Yes, for sure. Thank you so much, Jessica, for sharing with us. I think there are some great questions running on in the chats. I'm gonna ask another Jessica to unmute and ask her question because obviously, her question was sort of renaissance with a lot of people. Jessica Preston, are you like able to show up and ask you a question?
Yeah, sure. I don't have my camera with me right now, but can you hear me all right?
Yes.
Yeah, thank you for the talk, first of all. It was really candid and honest, and yeah, a nice view on a career, which I really enjoyed hearing. My question is regarding your transition, or your first transition into a leadership position. How did you get an organization to trust that you were actually capable of fulfilling a leadership role from previously not doing that before?
I think it was the other way around. They were convinced I could, and I was like, "Are you crazy? What's going on?" So I guess it comes back to my last answer there. I have a natural curiosity. I get involved in a lot of things. That's intimidating to some of my peers. It's not always great from relationships, but from a leadership, it stands out. I had to take some pretty hard feedback my first 7 to 10 years about what other people thought about that. I don't know if I could be different. It wasn't actually it's just my style of just being hungry to do new things and get involved and volunteer and say yes. And so those attributes stood out, and I was asked to take on the roles. I've actually never applied to a role. I've always been asked to take a role. I'm just a survivor, Jessica. I just get stuff done. I just see something and I think I can make a difference. So I just get involved, and I learned to believe in myself through the years because I did have managers and organizational leaders who were pulling me through. So I had awesome advocates, even in my first roles back in St. Louis. So I don't know if that's I have people come now to say, I want to take this on, and we know whether you can or you can't because we're giving you roles. So if somebody's saying that's great, how about you test this out? Even if you're like, but that isn't the job I asked for, there's some reason. So have a conversation with them. There's some reason they're looking for something to show you have the attribute, and less is more about proving it all. Don't let people fool you that you have to be proven. You can do it on the opportunity of the potential. That's something we suck as women. I didn't even know my potential. Somebody told me it because I didn't believe it. Whereas don't get stuck where you have to prove all the attributes of the leadership role before someone will give it to you. That's what we as women often do. We refuse to sort of go after something because we think we haven't proven we can do it. And I think, having that discussion with your leadership, it's not always your manager though. I don't know what level everybody is. Don't go around your managers. I'm not saying go around, be transparent, but it's very unlikely managers at the entry mid-level are the ones who can help with those things. So you have to find a way to do it without intimidating your manager, because that can be really exhausting. But I do think that it's a natural thing. if the organization's open-minded, it's a natural thing to see that you have the leadership, and it might start with matrix responsibilities if you can't have direct reporting responsibilities. Those are good ways to show them. Project leads where you have to influence without direct authority is an excellent way to show people you can be an effective leader, because it's what you do the rest of your career. You influence your board, you influence your peers, no direct authority, but you get them to do stuff.
Thank you so much for your answer, Jessica. We have another question here. I think, I don't know if she's able to ask about herself, but could you tell us a little bit more about how you weigh in between your career and your family? Because you mentioned that moving from to like different locations, actually you have to move your family with you as well. Like how do you weigh in between those two things? I think it's a very important question to a lot of women here.
Well, okay, so I'm fortunate this. My husband and I'll be made 32 years this year. And there are many trials and tribulations in that relationship through this as everything else, because it's just humans are humans. He's awesome. With my two boys being adults now, like they reflect on it. They would have disowned us if we had moved one more time. When we moved back to the US, we moved to New England instead of, we actually had the chance to go back to the Midwest and we didn't do it. And one of the key reasons was because of jobs. Like we needed to stop, like it had been enough, but our kids said they would go one place and we would, if we had to move again, they would stay and never speak to us again. They loved moving, but they're going into high school. They needed to sit still. So I think having like the reflection of there weren't any jobs in St. Louis, we had to move when we moved. And that is at first, like people don't move away from their family. My mother-in-law never forgave me. She's one of my closest loving persons, but I remember she said, how can you do this to me? And like, I thought I was going to have my grandkids here every day. And, you know, you have to figure out, we weren't chasing titles. We were just trying to survive. The companies were closing and moving and opportunities were not present. And so we had to go along that journey. And then I said in the prep call, which is maybe why you're asking this, I do not envy you guys right now. I don't know where you are in your personal lives. I don't know anything about your personal preference, but if you intend to be a mother who does have children, or you intend to adopt, or you intend to have a partnership with somebody with kids, I was very fortunate, not by design, but I had them in my mid-20s before I was 30. People thought I was crazy. I don't know if I had waited until my late 30s, early 40s, if I'd be in the jobs I'm in. I didn't have that fortitude to think about it, but it sure is hard to have young kids and juggle it all. And where the jobs are that we work in biotech are in metropolitan areas where there's a lot of commuting, high cost of living, high cost for daycare. We had to move from Chicago to Kalamazoo because our house, we live 2 hours away, and our taxes on our house were moving faster than the increases in our salary. And my two sons, my youngest son was born there, and it was $450 a week just for his daycare. Like we couldn't survive. So I get it. And that's what I mean. You have to lean into things and make choices on things. And would you stay in Chicago, or we turned down jobs in New York when they closed the Kalamazoo site because we couldn't afford it. Barry was going to be in Brooklyn working. I was going to be in Manhattan, and we could only afford to live in New Jersey. We took the trip and we did it. And we looked at the schools and we're like, oh, I'm tired already. So we chose not to and turned down jobs with no jobs and didn't know what we're going to do. And Pfizer said, we want you to move to Sandwich, which was completely intimidating, but, you know, tested it out. So I think figuring out what your network at home is, figuring out what your network at work is, figuring out what those things that matter to you are, like only you can answer that. And like, how are you going to be able to live through all those things is when you have to lean into choices for your family versus lean into choices for your work. And don't be sad about it. It all works out in the end. It will, just give it time. But if you can't make everything be perfect all the time, you just need to have a good set of relationships around you that you figure it out and can stay strong. And that way you can keep moving ahead somehow. I don't know. My sister's a single mom. He's 11. Braden's awesome, but without my mom I have no idea. No idea how she'd get her mental health breaks, let alone financially. It's crazy. So I'm glad I didn't have to do that. And I'm also glad I had my kids much earlier in my career. A lot of people are waiting for what they think will be a perfect time. I'm not sure if there is one. It's super hard. The whole thing's super hard, but don't be afraid. It does work out. So I don't envy you guys for some of these questions because yours are very different now than they are mine. I've been doing it 30 years. As I said at the beginning of this prep, my issues are not the same as your issues because we didn't have the infrastructure you guys have now. We didn't have working mom things. We didn't have long parental maternity. We did have to pay for daycare. We did have to be in the office. There's a lot of good stuff going on right now that you can build from. It doesn't make it easier. I didn't say it was not going to be hard, but it's a step, but there's still a lot more to do.
Thank you so much for your answer. I'm gonna call on our last question. Bagisha, could you ask your question? And since we don't have a lot of time now, I would appreciate if you can just be brief and go to the question itself.
Absolutely. Firstly, thank you so much, Jessica, for the insightful conversation. I want to be mindful of the time. I did go through going through a career transition right now. I went from bench to quality, and I heard your career suicide, quote. So I think you already went through some of that. Some strategies and mindset shifts that you pivoted transitioning these changes. I would love to ask your thoughts from your 30 years of experience on how professionals who just face these instabilities in their careers, I'm navigating my third layoff in 2 years, we can position ourselves for long-term career success and for a leadership role.
I mean, the relationships you had I don't know how long each of those were, and if there's any common thread of people. People are the key, right? So although I had a ton of transition at Pfizer, I was always in Pfizer. So there's not in like pharmaceutical sciences, manufacturing, quality, there wasn't a huge amount of so much change that you couldn't find some key people that could see you through that. So I would say you need somebody who can see what you've done, Bagisha, like what I said. Your role is only as good as what you can prove you did yourself. And so if you're going to be in these roles that are across different companies, you have to find a way to make that very visible because you can pivot. You could go to manufacturing, you could go to regulatory, they just need to see your potential and your capacity to do that. I do think right now is a strange time. There have been so many biotechs closing because of the funding issues. So I think the larger companies, the sooner they can start some better mergers and acquisitions and start unleashing the biotech, will be better off for it. So there is a little bit of a problem here with not enough jobs for everybody and tightening of the belts. But if it's in your control, find some way to really make it clear what your contributions were and what you led in those. Even if you're on a team, you still did parts of it that are yours, so they can see your skill set you've built and how you can mold it together, and that they can take a chance on you in the next role, or anybody that saw you in those roles. Like, stay close to people that were 2 jobs ago so they could speak for you across that 10-year continuum, and they can just see how you continued to build. Keep those networks strong from people that can be your advocates. Even if they're not your boss anymore and they're over here, just keep building it. And that way, when they do make the phone call on the reference call, it is obvious that, yeah, I saw them back here and I can see that they did that over there.
Thank you very much for that. I did have a follow-up question, I think the
Sorry,
rest of us might do.
Sorry,
Yeah.
Bagisha, probably don't have time for another.
Sure. I just wanted to know if she's willing to stay in touch and what's the best way to do that.
Yeah, just write me on LinkedIn.
Thank you. So Harsha, could you please close our conversation? And sorry that we don't have time to cover any more Q&A.
Yeah, thank you, Jessica, for this conversation. It was really inspiring for all of us. I gained so much. I think our audience also gained so much. Before I wrap up, there is a fun question that we really like to ask all the speakers. What's a daily habit that keeps you grounded?
I bike a lot. So those that look at my LinkedIn profile, I do a lot of cycling. So I try to get on the bike every day and give myself some mental health in the morning.
Oh, thank you so much. So is there anything else that you want to share with our audience before we wrap up the session?
I just appreciate that you actually wanted to ask the questions. So hopefully I was helpful, and I'm happy for you to reach out on LinkedIn, and I'll do my best. I like to play it forward. So let me know if I can be helpful, and thanks for asking me to join.
Thank you so much for joining us. I would like to sincerely thank you. It was really inspiring and encouraging. Thank you everyone for joining us today. And yeah, as Jessica mentioned, you can follow her on LinkedIn and be in touch with her. Thank you all.
Have a great day.
Bye.